Okay. All right. What's the weather like down there? It's so muggy up here. It's disgusting.
Oh, yeah, I can't stand the humidity. It's going to be hot today. We're having a very hot start to summer this year in Melbourne.
Yeah, yeah.
32 today, I think, or 30, something like that.
Oh gosh, that's disgusting.
Celsius, obviously.
Yeah. So it's around the 90s for people
Yeah,
that are in America, all the Fahrenheit people.
yeah.
Yeah. Okay, we might get started then. Welcome everybody. Welcome, Dr. Dennis. Your talk was on day 2, I think. Yeah, day 2, I think. Yeah. But we are going to be talking about medication and how it can help with behavioral issues. Maybe before that, though, maybe introduce yourself and just give us a little bit of a background about what you do and all that sort of stuff. So
Yeah, sure. So, look, my day-to-day work is I work as a veterinarian doing behavior cases. And for people that don't know what that is like, it's not quite the same as a dog trainer. It's a bit more like in the human world if I was a psychiatrist. So looking at behavior and mental health in animals, just like humans do, but also looking at the option medications, whether they're right, and if so, which one and how to do it. So that's my day-to-day work. I was a vet for years before going into this full time, just a small animal vet doing dogs and cats in private practice. And then I actually did a PhD in dog behavior because I was so interested in it and I loved it so much. Then I went back and I did some in Australia, it's called memberships in veterinary behavior. So it's like a college examination that you have to do a whole lot of extra study for to pass. So I got that qualification as well. And yeah, now this is what I do. I wrote a book as well, which obviously we've promoted previously, but yeah, happy just to chat today about, yeah, anything that you guys find interesting about medications. I always have so many questions and devote so much time in my consults. Often half the consult is spent talking about medications because there's so much to know and so much to understand at different levels, the individual
yeah.
level but of the medication, but then just in general, like why do we even medicate a dog? Why would you even want to do that? So yeah,
That
there's a
is a
lot to
good
go over.
question. So maybe we could start with that. Why would you medicate a dog? Where does the dog have to be in its mental state to require medication?
Yeah, that's a good question. And I always fall back on first principles. And that is that, in medicine, you want to do no harm, right? So you want to medicate a dog when you don't think it's going to obviously make the dog any worse. So that means you've got to be careful and considered about what you use, how much you use, and that you've got to make sure that it's not used blindly. So, the worst thing that I see happen is when a vet prescribes a medication for behavior and the owner rightfully trusts that vet and thinks, oh, the vet knows what's best, I've got to give this medication, right? But then if the owner just gives that blindly and doesn't actually look to see, is it actually helping my dog? But rather thinking, oh, the vet knows best, I should just do what the vet says, right? And so you can run into real problems there because, when you should give a medication is when it helps, but the catch-22, you don't know if it's going to help until you try it for any medication. Humans, people, there can be side effects for all of them. And you hear horror stories, don't you, about medications that haven't done well in an animal, right? And I can tell you, I believe them. I think that medications can have bad side effects for some dogs. And you don't know which dog is going to have the side effects though. So that same medication that you'll see people on the internet, saying, oh, I gave, Prozac to my dog and it made it really sick and aggressive and it was a horrible drug. And, I can't believe people give that to their dogs, but 4 out of 5 dogs might do fine on it, right? So you can't just give these blanket statements about, what drug is the good one or what drug is the bad one or anything like that. It's really much more nuanced. So to answer your question, you give a drug or a medication to a dog when you think that they are in a mental state that is suffering and they need help, and you think the medication might be the right one and it might help, and you want to give it a go, right? Have a trial. You never know for sure before giving it. You never know. Yeah.
Yeah, I think it's a really important point. And I think what you described was that paradoxical effect. So the medication had a completely opposite effect on the system to what you want. But I
Happens
think
rarely, but it does happen. Yeah.
yeah. But with I think with like what you're describing is it's a lot like for me with my clients. a lot of what I do is, and I'm sure it's the same for dog trainers and for vets as well, is kind of data gathering in a sense, because like you say, you don't know if it's going to work. So we have to test it out and see if it works or not. And I think the issue with what I see a lot is, oh, I tried it, it didn't work. But they're not having that dialogue with their vet. They're not going back to the vet and saying, this is what I saw. So now what do we do?
Yep, absolutely. And, knowing how to measure if it works or not, a lot of people, they come to me and they've rightly got some very upsetting issues. Like, for example, I saw a case, I think last week or the week before, with really severe separation anxiety. This poor dog was really suffering bad. They were already on multiple medications and they weren't quite sure, because I hadn't seen them to begin with. They'd been to another vet and they weren't quite sure what was doing what, and how much of an effect they were having. They knew the dog was a little bit better, but they couldn't really tease apart or tell what was doing that. And so part of the issue was that I think that from day to day, dogs have good days and bad days with separation anxiety. They often do, they don't always, but often, they'll have a few good days and they'll have a really bad day, then they'll have an okay day, and it just goes up and down and up and down. And it's really hard to measure and keep track of where your dog actually is at that time, because there's that variation. But, the thing is that if you want to then measure how well a medication is helping your dog, you don't know if something else has caused your dog to get better or worse when you start it, because there is so much variation there. And I prefer people to use something more stable to tell if the medication's working, like how the dog acts around them when they're home, because that actually tends to be much more stable from day to day in terms of how the dog acts. And then they can pick up if their dog's a little bit calmer when they're around them, right? And that's actually a much better, yardstick of telling, how's the dog going. Obviously, if the dog is cured magically on the medication, well, that's great, but often it's not that simple that they just suddenly get better on the medication. It's often much more gradual, and you have to be much more considered in whether or not a medication is actually helping an animal with their behavior and helping them to
Yeah.
feel better. Yeah.
And those dogs where it works first time, first medication, and it works,
Oh,
that's like hitting the jackpot, isn't it?
yeah,
Really?
absolutely.
Yeah.
And it's not that rare, but it is. It feels like the jackpot because it is so great when it happens. And it's a combination of being a bit lucky that you pick the right medication, because it is a bit of luck. There is some obviously experience that goes into it well. A bit of luck in terms of the dog, just happening to respond really well to that medication, and maybe being in the right mental state, depending how serious the case is. I find the cases that are extremely serious, you rarely get that amazing improvement. And the cases that are moderately serious, like not really bad, but not an easy case, they're the ones where you sometimes do see that huge improvement, because it's sort of has to do with, I think, how stressed out a dog is. When they're really, really, really stressed, even if you have a medication working well, it can be hard to see the improvement, because it's like they're already so far past the threshold that if you bring them down, they're still above the threshold. So it can be hard to say. Yeah.
That's a good point. Yeah. So if a dog, for example, has a reactivity issue, so they go out into the big wide world, they see another dog or a person or whatever it is, and they're reactive, how would you apply medication? Obviously, it depends on the dog and all that, the medical history and all that. But is it more to get the dog to the point where it can think clearly? Because obviously, if they're, so that the trainer or the human component can do the training to help the dog cope better.
Yeah, I think thinking clearly is definitely one way of putting it. I think that's the end result. I think the reason they can think clearly when it works well is that there's not as many emotions clouding their judgment. I think that, highly reactive dogs, when they're in that state, they are not thinking logically at all. They are just acting on absolute instinct. And, like, people are the same. Like at times you can't think clearly if you're really
Road
upset.
rage.
Road rage is a great, yeah, that's a good example. Yeah, you can't think clearly. You don't do what's logical and what you would do if you were sitting down and calm. And you can't learn either well. You can't learn while you're really upset. There's actually it's not just something that I've noticed and that people notice, but there's, you know, studies that show the neurochemical links between stress and learning. They're actually inhibit like long-term memory and learning when you're really stressed. So there's a lot of reasons why having medications that can bring the emotional state in into a state that is actually liable to make new connections and learn and understand that, you know, it's something that an animal, you know, that a dog has had a gut reaction to, that they can actually learn to not have that gut reaction, you know, emotional learning, because that's what it is. It's learning. When an animal, you know, when a dog is really reactive and then they become not reactive, that is because they've learned. They have actually learned to have a different emotional reaction to what they see. And so one other point on that is that to be ready to learn that switch, they actually have to already be in a relatively calm state compared to that reactive state they're in. It's very hard for a dog to learn to be not reactive if every time they're exposed, they get put into a state where they are reactive every time they're exposed. We need to get them at that state where they just sort of notice the thing that they normally are triggered by, but that they're not in that really highly aroused state.
And that makes a lot of sense. But what about just talking about the stress and the learning? Some stress is good though, isn't it? Like there's that eustress, which is actually beneficial to the dog. So how do you get, you know, how do you figure out where that is for the dog? If that makes sense. Not, my question's not very clear. I hope you know.
No, I get it. I think that some stress is useful, yes, absolutely, to a degree. But I think that in general, people don't have problems with having their dog not being stressed enough. That is not normally an issue that prevents improvement in a case. So in all the cases that I've seen, I've never seen a lack of improvement because the dog isn't stressed enough. I've always seen a lack of improvement because the dog is too stressed. Yes, a little bit of stress can be useful, can be adaptive, particularly in like what we call the quote unquote like normal neurotypical dogs. So dogs that don't have an anxiety disorder, that aren't, you know, suffering from extreme levels of stress. But in those dogs, a little bit of stress, you know, during learning can be productive. It can give them a challenge. It can make them want to succeed and give them a drive to, you know, push through it. And that can be really helpful and adaptive. But, you know, every dog copes with stress differently. And so, yeah, I think that there are certainly some dogs that are sitting so far away from eustress and in just pathological stress that it's not a problem at all. That's a lot of my cases, actually. Yeah.
That's really interesting, isn't it? When you said every dog, and it applies to humans, of course, as well, you know, deals with stress in different ways. And I think resilience is really big. You know, a dog that's robust and resilient and therefore more confident is going to be able to cope with the big wide world than one that's not. And I guess in a sense, what you're doing with the medication is helping the dog become more resilient to enable more learning, would you say?
Yeah, absolutely. We do see that when a medication works well with the dog, that often if they do go through something that would stress them out, the trigger, you know, being left alone or being, you know, seeing another dog on a walk or whatever triggers them, they tend to bounce back faster. That's one of the things we notice. So often people will say to me, oh, look, it didn't work. My dog still barked at another dog when it walked past them. And I said, well, I might ask how long they barked for. And they say, oh, actually, it was only 5 or 10 seconds. Normally it's 2 minutes that they're barking for. Like, well, that's a huge improvement. Like that's getting to the point where you can really start to learn soon. We're almost there. So yeah, that's really good.
Yeah, that's interesting, isn't it? The owner's kind of perception of what they're seeing kind of does play a role, doesn't it? You know, and you know, that small improvements is when you're in it, you don't see it until you take a step back. And that's where someone like yourself comes in, because you're like that independent kind of observer that you can actually see there is a huge difference between A and B.
Yeah, absolutely. It does often happen, but it goes both ways. You know, I think like I said at the start, the issue can be when people just assume a medication must help and they just give it blindly. You know, you really got to try and learn to watch your dog and read their behavior. And that's what I spend a lot of my time coaching my clients to do, is to get them to really read their dog's behavior, because they're the ones that have to ultimately feed back to me how their dog's going. And if they don't understand how their dog's feeling or at all anyway themselves, it's really hard for me to get a gauge on what to do with the medications or whether to have them on them or not.
Yeah,
Yeah.
and that's a good point, because I think we mentioned this in your interview, which, gosh, that was a while ago now. So my mind's like, about what did we talk about? But um saying about the there will be some dogs that must come to you and you wouldn't put them on medication. Like, you're not one of these vets that are like, oh, here's, take a pill, take a pill, take a pill, sort of thing.
Yeah, good. Yeah, no, I don't think we just cover this exactly. So yeah, that's good. I absolutely don't. I do have cases that I send off to a good quality positive reinforcement trainer and recommend that, they just have some good training. One of the reasons I think I would get much more if I was a lot cheaper. I think I'm not an expensive, a good behavior vet is not cheap to see, partly
No.
because it takes me so long to do a case. Like, I have to charge for my time. And
Yeah.
so generally people have often tried other options first. So I'm not
Yeah.
seeing first line cases that are just simple training problems, because the dogs that have problems that are easily fixed by, any old trainer, the easiest, training problems to fix, they've generally been cleared up already by someone else that they've often seen. I'm often not the first person they've seen. When I am, then I do get the odd case where I'm the first person where I say, look, I don't think we need medications. I probably have a couple every year, so not many, but I get a lot of my referrals from good quality dog trainers that really understand when
And it's
medication is needed,
necessary. Yeah.
because they can't get anywhere with the training they've tried, and I just realized that the
Yeah.
dog's too stressed, and they know that.
Yeah. You
Yeah.
get to a point where you kind of you realize they need that extra support.
Yeah.
Do you feel that not yourself, but that maybe dogs are a little bit over medicated? Because you do read that quite a lot, that that maybe trainers are encouraging the guardians to go and get medication where
Yeah.
maybe
They can
it's
be.
not relevant or necessary. And I do see a lot of pushback from trainers online saying, oh, dogs are over medicated, and this dog, if it comes to me, I'm taking it straight off the meds and blah blah, all that stuff. So yeah,
Yeah.
where do you sit with that?
Look, I think that, you'd have to do a study and, like, survey all the dogs out there. It'd be a lot of work to figure out exactly how bad the problem is. But I undoubtedly see dogs that go on medications that maybe didn't need them, or they just didn't have the right training advice. And, especially people that put their dogs on medications and then keep putting them through stressful events that they can avoid. Like separation anxiety is a good example of one. Dogs that maybe do improve a little bit on the medications, but that some other simple fixes could really make a big difference in terms of their environment. The way they're kept at home, like, maybe having them inside, rather than locked in the backyard, or something like that. That could potentially, actually, that's a good one. I've seen a lot of dogs that if the dog was not in the backyard and just in the house, they wouldn't need the medications at all.
Yeah.
Like, I've seen
Yeah.
those
Yeah.
cases before. So it
Same.
does exist. And yeah, but I think that it's hard to know which dog it is. And if you have a blanket rule that every dog has to come off medications, like, you're going to be doing a lot of dogs that, a lot of my cases would just be ruined if you did that. Because we've worked really hard to figure out what medications are doing what, how helpful they are, and then keeping the dog on the helpful one at the right dose. And undoing all that work, they would go backwards very fast. Yeah. But it's not all about the pharmaceuticals either. There's the natural therapies too, like, have you heard of, like,
CBD.
alpha casozepine, that's in Zilkeen, or
Oh
AC for
yes.
Dogs
Yeah.
is the new product. So a lot
Sorry, what was the new product?
AC for Dogs by Companican. It's in Australia. That's just come out. So that's another example of it's the same active as Zilkeen, which is alpha casozepine. That's part of what's found in milk protein. So I think you might have heard, for example, that newborns and infants, if they're having milk, it calms them down. Like, it actually has an effect on their brain. And they've done studies in rats, and they've looked at how it works. And there's a little molecule in the milk protein called alpha casozepine, which can be sort of like released and made active with using some digestive enzymes, which is how they make these alpha casozepine products. Anyway, that molecule, they found it actually binds to the same receptor in the brain that Valium binds to. So diazepam, which is, quite a potent anti-anxiety medication. But it's completely natural, and it is, it doesn't have the side effects of, like, sedation, and you can't overdose on it or anything like that, because it's based off milk. But yeah, it's available as Zilkeen traditionally, but also now this new product, AC for Dogs. It's an Australian product by Companicum. So yeah, you can search for that online as well if you're on Aussie. But yeah, that one's actually, it's cheaper. It's less cost. So I like it a lot. But
Yeah, I know. I think that's the thing. Like a lot of dog guardians, and this was kind of leads me into my next question. But I think a lot of dog guardians want to try all the natural things first before they go into the prescribed medication. But and I like to take kind of more of a holistic look at the issue, and what can we add in to whatever we can throw at the wall and see what sticks, kind of thing. So whether that's pheromones or things like Adaptol or essential oils or CBD, or even if they do end up on prescribed medication, or even before, during, or after, then what else can we do? Just every little bit counts for me. But do you, and guys, if anyone's got any questions, please feel free to start typing them in the chat so we can get to them. But while you're doing that, Dr. Dennis, do you think people should be afraid of medication? Because that's what I hear all the time. Oh, it's going to turn my dog into a zombie, blah, 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 all that stuff.
I think a little bit of fear is healthy. Because if there was none, then I'd worry that people wouldn't look out for the side effects that can happen, especially at the wrong dose. So I would not want people to just have no fear at all and blindly just give these medications. But certainly people can be overly fearful of them because of scary stories and like bad stories they've heard from other people, which are all examples of essentially the wrong medication, the wrong dose, or just a dog that is just sadly a non-responder. We don't get them often, but you do get the odd dog that you can't find anything that helps.
Yeah, Jenny has actually got a question she would like you to answer. She's going to actually unmute though. So Jenny was a speaker from is a speaker on the summit. Yeah, so she's just going to ask. She just said, can she ask a question?
Sure.
Yeah, hi, Dr. Dennis. I just thought it's easier for me to ask rather so than type. I just wanted to know about your success, because one of the things that wasn't spoken about in your talk, success with really, really severe compulsive repetitive loop behaviors in dogs. That was the first question. That are way over that threshold that you talk about. Like I'm talking way over the threshold, but then can be very normal. So, Dr. Jekyll, Mr. Hyde type thing, goes from one extreme to the other. The other question was, do you do Zoom consults? I did go on your website and I could only see that you work in the Melbourne area. And my third question was, is there an age?
Let's just do one at a time.
The last one. Oh, okay. All right. So I just didn't want to take up all your time.
Yeah, no, you're right. We'll just come back because it's he might forget. So maybe start with the Zoom consults. That's probably
I'm not doing Zoom consults right now. There certainly are some very good behaviour vets that do Zoom consults Australia-wide, and I can recommend them, like Melanie Rockman at Wild Things Behaviour, Ashley Hargreaves. Where is she at? She's at Fur Life Vets. They both do Zoom consults. A lot of the specialists will as well. Who would be the other one? Jackie Lee. Yeah, Jackie Lee, Lay is her surname. I think she does Zoom consults as well. So, but there's more. And I just don't do them because I am fully booked with local consults and I prefer to do local, but I should change. I should move on to the Zoom. And your question, what was your question, the first one again?
It's about the OCD.
That's right. Yeah, the really severe OCD cases. I've seen, incredible improvement in some of them, especially where there's some physical underlying causes. So, for example, pain. So I've seen a lot of cases where there's some underlying pain in them that I've been able to diagnose or figure out and get to the bottom of. And certainly, yeah, with the right medication, some of them can make a big improvement. I've fixed spinning in a lot of dogs. And I guess that it comes down to a combination of knowing what that trigger is and being able to avoid it as best as possible, and the dog responding well to the medications, you know, assuming they respond well. But it really, with those OCD cases, it's often just, like you said, a sign of severity. And sometimes, you know, we throw around the term like obsessive compulsive disorder, but I think that it's not always clear that it is. Sometimes I think it is just a severe stress coping behavior that the dog's doing over and over because they are so stressed. Whereas other times it is a compulsive. And from a technical point of view, you can't actually know like if a dog is feeling obsessive over something, because you have to actually ask them. So there's some nuances there, but I think that, with those really severe cases, you can get a lot of improvement in some of them, but it just depends on the case. And pain's a big one for that. For those circling dogs, sometimes they've got neuropathic pain around their tail base or in their hip area, which causes them to do that as a coping behavior for the pain. And if you can fix that pain with the right medication, sometimes you can get dramatic improvements. But it depends on the case. They're all different.
I think, Jenny, you said you've got a dog that's struggles with it, haven't you? Was it a little Staffy, I think you said?
Phyllis Lorraine. I took her on about 3 years ago. So she's 5 now. She'd been through 5 homes. She's seen Rowan Kilmartin. We've had all sorts of things done. I work with her through applied zoopharmacognosy and other things. We've really sort of been through and analysed and diagnosed. And she, I've never seen anything like it before. When I say compulsive and loop behaviours, I'm talking everything was done in threes. Everything was done clockwise. So she would go round something 3 times. Her ears, in actual fact, are to one side. So she's been doing this for a very, very long time. I've seen massive improvements over the 3 years, but she'll be fine. And then all of a sudden she'll just get into that pattern, and it's yip, yip, and bounce, 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 bounce. Everything's 3, and then she'll move to another spot. Nowhere near as severe as it was, but she spent a lot of time in a kennel from a very young age. She was only 2 when I got her, so she wasn't fully developed mentally when I got her. So there was a lot of that. So we've gone a long way, and you talked about it. I'm not a big fan of medication. However, I do understand that conventional medicine is needed, and I was just sort of interested, whether it's worth looking at, or whether I just keep going, doing what I'm doing and seeing the improvements.
Hard to say. I think another perspective's often good. I've seen a lot of cases where no one's known, but the dog's actually been in pain. None of the trainers have been able to tell. The dog's actually been in pain. They needed to see a behaviour vet. Normal vets haven't been able to pick it up, often because they can't touch or examine the dogs properly. And just, I think, being a mixture of being a veterinarian that has dealt with pain and disease in dogs, plus understanding behaviour and also understanding behaviour meds, just the combination of it all. I think, there will be cases out there that trainers miss if they never refer to behaviour vets, because I pick it up regularly. A lot of pain in a lot of cases, like not every case, but every few weeks I'll see one that no one's known. And the dog's we've treated the pain and they've improved a lot. Just saw.
Right. Yeah.
Believe
anatomically,
it looks a lot like anxiety, stress, irritation, grumpiness, reactivity, all of that. Anyway, it's worth
just
noting.
Thank you. We have looked at all those things. I've pretty well been down every rabbit hole just about. But the last question was, is there an age you would not medicate a dog? So,
good question.
when we talk about brain development, I've dealt with some dogs that have been on antidepressants from a very young age, and it's had a terrible impact on them. And then when we've taken them off them and started working with them, I've just seen incredible results. So I just wanted to know if you know, you draw the line somewhere. Thank
Yeah,
you.
so I think, thanks for that, Jenny. I think that it really depends on the case. And absolutely, there could be cases where dogs are put on medications at a very young age and they didn't do the empirical work that I've talked about, which is where you check and see that the dog actually does improve on the medication. You check to see they don't get worse. You check to see that there's no side effects before giving it. So in a case like that, then, you know, if that is done at a young age, I believe that if you took a dog that didn't need the medications and gave it to them, that unless there are side effects that are actually making the dog worse, it is a safe medication to give. It's a complete waste of money in that situation. And I think it's a waste of the owner's time, and it's not good to give a medication when it's not required, but it doesn't actually cause damage in that situation. The only time that these medications cause damage is where they're actually causing anxiety themselves, which can happen, absolutely. And it comes back to monitoring the case and making sure that you know. So it's very easy. I see cases, you know, many times a year, many times a year, where they get worse on the medication that I prescribed. Happens all the time. And I simply take them off it. It's not that hard. You just have to be able to read and know that they actually got worse on it. And so to say that, yeah, absolutely, like there's going to be cases like that where that process hasn't been followed, where you haven't actually looked to check to see if the medication is making them worse and taking them off it. Because yeah, it's definitely not a blanket statement. There are some cases of young dogs that are extremely stressed, extremely highly strung, anxious from a very young age, like 12 weeks, 16 weeks, where I'll see them. And, you know, it's pretty obvious to me and any trainer that sees them that this dog is not like the others at this age. This dog is acting very differently, highly stressed, highly anxious, highly fearful. And those dogs do great on early medications. They do really well. And if you look at how they go, you know, 2 years down the track, they're like a normal dog. Whereas we all know that how that will normally end up, a dog like that without medications when they're that young and that stressed, is that, you know, it's not a good sign if it happens that early. We normally see these, you know, really stressed, anxious behaviors start to crop up at later ages, you know, 6 months, 9 months, 12 months is often when we start to really see them. So if you see that really rare outlier where it's happening at like 3 months of age, that is a sign for early medication, in my opinion. And you can turn these dogs around. These dogs can grow up to be normal dogs if you catch it early enough, because otherwise they learn bad behaviors, they learn, you know, fearful reactions, and they go through these fear periods when they're already highly stressed for genetic reasons. And it's, yeah, it can save their lives, really. You can, but it's got to be
That's really interesting.
Yeah.
So you mentioned monitoring, like you say, that's so important. So if a dog was put on medication, and as I said, I hear so often, I tried it didn't work, and they didn't go back to their vet to have that conversation. What do we do next? How often should that monitoring occur? Like if you've got a client and you put the dog on medication, how often would you say, I need to talk to you again? You know, is it in 2 weeks? Is it a month? Is it 3 months?
Yeah, so we need to distinguish between, I guess, a normal vet and behavior vet. So normal vets can't really do this. They're not trained to, they don't understand how to properly monitor medications. And those are with the situations where you do get the horror stories of the dogs that were worse on the medications and improve once you take them off it. But a good behavior vet, as long as they are seeing their patient regularly, it shouldn't ever happen, because we are very good at knowing when a behavior medication is helping or not and how to pull them off it. Because that's all we do. You know, you'd hope we're good at it. I've lost track. What were you saying?
No, so how often would you monitor one of your clients?
Oh, at the start, continuously. So for the first 10 weeks on a new medication or starting the medications off, it's like I give, like, you know, feedback whenever required. So the owner has a whole bunch of trigger points to know when to reach out and say something's not right. You know, they need to look at how their dog's responding, look for all the side effects. We go over all the side effects for the medications that those are on, all the common ones. And then basically they need to let us know if anything's going wrong or not going right. And then we check back in regularly and make sure that the medications are helping and adjust as necessary. And there's often, for me personally, there's often quite a bit of emailing back and forth for some patients, because it's not right to begin with, and other patients, nothing, because it just works. So it just depends on the patient and how it goes. But yeah, a lot of education to begin with, and then the owner needs to know when to reach out, and I try to really make it clear when to reach out. So any side effects, any deterioration in behavior in any way, and teaching them how to read the behavior and know when there's deterioration. Yeah, so, but long term, if a dog's stable, every 6 months to a year for a revisit with me. You know, if they're doing really, really good, yearly is fine, because they can see their vet in between them, as long as they're really stable, like no issues at all. But yeah, for a dog, normally for the first revisit, it's 8 to 12 weeks for me after a revisit after the first one, just so I can see with myself. I want to see the dog on all the meds I prescribed on the day. I want to see exactly how they are, because even the best owners, they are not a professional at seeing dogs on and off medication. That's all I do. So I can see the dog on the medication. I can pretty quickly pick up, you know, with experience. If the dog's on 3 medications, often I can just tell, like, from the owner's description, which one's causing the problem, if there's a problem. But that's complicated, you know. It takes a lot of practice and a lot of learning, and there's no way an owner or a normal vet could be expected to do that. So yeah, again, just the benefits of, if you're going to have a dog on behavior medications, seeing a behavior vet is going to be the best way to do it. It's going to get a lot better success. I think I mentioned last time that if you put a dog on, you know, fluoxetine, for example, and another drug like, you know, maybe trazodone or something, a lot of vets use that in Australia. And if you just get a normal old vet to do that for a dog, and then you get a behavior vet like me or one of the other amazing behavior vets around Australia to do the same medications in the same dog, you get double the success rate through us. Like, honestly, like, you'll get double with exactly the same medication, because we're going to know how to adjust the dose, whether to take it off, keep it on, like, coach the owner through and everything. And it's just incredible how much a difference it makes. And there's a reason why there are psychiatrists in human medicine doing this, because it just makes a huge difference. Yeah, it really does.
So if a dog was put on medication, and I know this is going to it's going to vary for dogs, but I mean, should they expect that the dog is then on that medication for the term of its life, or?
Good question. And I think that it really depends on the dog and on the environment, you know, they're going to be in. You know, if you've got a dog in a really just crappy environment, like in humans, they have what is called situational depression. You know, you've gone through just a crappy life, you know, half your family's died, you're in an abusive, like, you're in a job that's abusive and it's the only job you can get. And like, literally, you are just living like the worst environment you could possibly have as a human. And you are going to be able to cope better on an antidepressant. Like, no, it's not good. You'd much rather have a good life. But yes, it's like pain relief. You know, like if you've got sore hips, you're going to cope better with pain relief on the sore hips than you are without. And so, yeah, no, it's not ideal at all. Absolutely. But, you know, for dogs that, you know, the severe separation anxiety cases like you've seen, but where the owner has to always leave that dog alone every single day, no matter what, and they're adamant that it can't go to another home and that they can't be home, you know, or have anyone else home to babysit it, it is like pain relief for that dog. And if they are in that situation for the rest of their life, then the medication is going to be required for the rest of that life, because nothing's changing. They're in a crappy situation. But there's other situations where, you know, for example, if a dog's just had some really bad luck, they've had some poor, you know, socialization experiences when they're young, for example, they've learned to be fearful of other dogs, and training's just not cutting it. For some reason, the dog's just not responding well. Sometimes medications can be used what required to get that dog over the hump of training, get them to learn to trust other dogs and improve, and then the medication can be weaned off afterwards. Now, that's definitely a situation in some cases, but where there's a genetic cause of excessive anxiety in a dog, the dog will return to being anxious once you wean them off the medications afterwards. So it's almost like a personality. Like, some people are just really nervous sort of people, right? And that may be fine. They can live happy lives being nervous, but if they go on the medications and they become less nervous, that's great. While they're on them, they're less nervous. And if you take them off, they're going to be nervous again. And it's the same with dogs, right? And if that nervousness is causing a real problem in that dog's life, then whenever they come off it, the medications, that problem is going to come back, you know, whatever that problem is.
Depends, doesn't it? So Rebecca says, will you do a pain trial without a clear diagnosis?
Yes, I will in some situations. So, you know, as long as it's safe for that dog to take pain relief medications, And if you know that there's just something not right about this dog, they're not responding, they've got one of the behavioral conditions that is commonly known to be coexisting with pain, like, for example, noise sensitivity is another one, compulsive disorders. Often there is underlying pain in them. Then yeah, often we will do that and see how they go. And again, being empirical about it. So if a dog improves out of sight on a pain trial, so that is essentially what that is. It's where you give pain relief medications that are safe to give, like not like opiates, like not like a morphine or something. We're talking like a Nurofen for dogs, or maybe, you know, neuropathic pain like gabapentin. And we give that medication for them. And if they improve a lot, which generally it's quite dramatic with pain, so it's not like they just get a little bit better, but suddenly it's like, wow, we've got a different dog here. This dog is so much happier now. And so, yeah, you start them on that. And if they improve out of sight, and then we then try stopping the pain medication. And if they go back to how they were, put them back on it. And if they improve again, it's like, well, even if we can't diagnose the actual cause, like clearly this medication is helping a lot. So it's absolutely worth keeping them on it. So yeah, I think that, yeah, I will absolutely do that. Good question, Rebecca.
Anyone got any more questions? And maybe if anybody's typing, you could, while they're doing that, you could tell us about your book that's just come out.
Yeah, sure. So it's a book that's a story about two different dogs and how they struggle in society with not being understood by the people around them. Thankfully, there are a few characters in the story that do understand them properly, and you get to see what works and what doesn't, and sort of through the mind of the dog, without anthropomorphizing, sort of how, you know, a dog might react to different training philosophies and medications. And yeah, it's a really nice read, and a lot of positive feedback from dog trainers that are positive dog trainers and owners that have got reactive dogs. Lots of positive feedback from those kind of readers who find that it is a nice read, very eye-opening. It's got some interesting science in there, and you know, some of my philosophies about dog behavior as well. So yeah, it's definitely worth a read of anyone that's interested. Yeah, it's called A Dedication to Difficult Dogs.
Available on your website?
It is, yeah, through a link. If you look up the ABAdog website, and then if you go to one of the links to Difficult Dogs, it's there. But it's easy just to search my name in Amazon or Google, and just search for my book, Dennis Wormald book. It will come right up at the top. Yeah.
Oh, you got it, Robin. Yeah. He wrote it above, The AC for Dogs by Companioncalm. Is that available? I know you said it was available in Australia. Do you know if it's available overseas as well?
No, it's an Australian company, and they've just launched it. So
right.
Only available in Australia. And I know a good positive dog trainer, Chiara Perry. I don't know if you've heard of her. She's a Melbourne trainer. She's amazing. She's a PPGA member, and she's tried it on her little dog that she thinks was going through a fear period just recently, and she started them on it, and she thinks it's helped a lot for her dog. And I've got another client that has just used it as well, and it's got great feedback on it. And then a third client that thinks it didn't do too much. But that's the same with Zilkeen. You often get two out of three dogs responding, and 1 out of 3 not, or something like that.
Yeah.
So yeah, it seems to be good. It's a lot more cost effective than Zilkeen, and it's in a powder form, which makes it easier actually for a lot of people than giving a capsule. You just mix it through the food, and it's tasty. Yeah, I like it.
Well, and can you maybe write in the chat what's the actual active component, the constituent? Because maybe anybody overseas that wants to find out more about it, they might be able to Google it and find out what's available in their area.
Yeah. So in that area, generally it's only the Zilkeen throughout the world, as far as I know. But there are some diets, I think, that have it added in.
Oh, there you go. Alpha
casozepine. Yeah. So that's the
casozepine.
Yeah. So that's why AC
I'm laughing
is easier.
because
You can just say AC.
yeah. I'm just laughing because Jenny works with Zuma Pharmacognosy. Did I get it right, Jenny? And I can't say that word.
Yeah.
So I'm just laughing because I'm going casozepine.
Applied zoo pharmacognosy.
Yeah, that's what I said.
Yeah.
I'm joking. So Michelle says, are there any breeds of dogs that should avoid certain medications for behavioral modifications? Ooh.
It's a good question. Generally speaking, not really, but there are some cytochrome P450 mutations in, I think, some collie breeds, which can alter drug metabolism. And certainly if you had a dog that was in the line, so like, for example, if you knew that a dog that responded poorly to medications with a side effects that made you think that there was some sort of metabolizing issue, like severe reactions to a drug, then you'd be worried about any dog related to them potentially. But it's not like a breed thing. So it's not like there's just one breed that's not safe to try these medications in.
So I guess for you, it's because you're doing those in-person consults, it's, because I'm sure not, I'll try and speak. The caregiver's placebo effect. So where the caregiver wants the medication or whatever it is, doesn't even need to be prescribed medication to work. So they see it working, whether it is or not. And that could be giving a dog rosehip vital for arthritis, and they're so invested in the process that, oh, it's working. But I guess from your perspective as a behavior vet that sees them in person, you can actually, you're gonna have a better idea. You're not going to be caught up in that.
Absolutely, yeah. So it doesn't happen often, but I do have cases where I go back for my revisit and I look at the dog and the owner says they're better, and I say, nah, something's not right. We've got to change something. This isn't how it should be. And I point out to them the behaviors that I'm seeing. I'm saying, we didn't see that before. That's bad. Something's happened. But thankfully, I coach them really well to begin with on what to look for. And certainly, yeah, I think that there is a caregiver placebo effect, absolutely. And it's really important to have clear goals and measurements around what you're actually looking at, rather than just asking for a general opinion of if you think things have gone better or not, right? So we want to know, I often ask people to time or measure things. So like, how many meters away from another dog does your dog start barking? How long after they see another dog do they continue to bark for? How are they able to be distracted by treats when they see another dog from a distance? And I note all these things down at the first visit, and I very clearly write them all down, and I ask them again about what's happening now, and then we just compare, right? And we compare to my notes from the start, along with me looking at the dog and checking to see they're okay. And honestly, it is more often that I see that an owner doesn't notice an improvement when there is one. I personally find that more often than a dog seeing an improvement when there wasn't one. Often because people are quite frustrated by a lot of these behaviors and finding them like really difficult for them to deal with. And so, maybe they could imagine a small improvement, but I don't think they're imagining large improvements.
I have a question. It's a bit of an odd one, but in terms of owners' anxiety, how many of your clients do you think either are on some sort of medication themselves, or maybe perhaps should be because they're anxious type personalities, and maybe they're feeding that onto the dog? I know it's a bit of a curveball, but
that's a tricky one, because there's not a lot of research on that. And what research there is, I've read the studies that have been on this that I know of, and in my opinion, they've missed out on some pretty major factors. I do personally believe that it's perfectly normal in a social group for anxiety and stress to be communicated between species and between individuals of a group.
Oh,
it's
totally.
very normal in a family, and just amongst humans. If someone's really happy, the whole family sort of cheers up a bit about them. You see someone laughing, like you feel happy, and vice versa. If someone's swearing and smashing the wall and like storming, slamming doors, everyone's a bit on edge, and that's normal. And it's exactly the same with dogs as well. If they're doing alarm call, essentially what's an alarm call? Like barking at the front of the house because they're worried about an intruder, right? It's designed to alert and alarm the whole group because there's a potentially danger, right? And it's designed to stress you out as an owner, and vice versa. I think it goes both ways. I go into it a lot more in my book, but certainly I think that the behavior and how an owner is feeling can rub off on a dog just because it's natural. It's normal in a social group. It's a normal thing. And it can
Yeah.
be part of the problem. But I always tell people it's never the sole cause. Like, you know, if you take a dog that's really just a calm, relaxed, chill dog, and you put them in with an owner that's got an anxiety disorder, unmedicated, a highly anxious owner that's, you know, bouncing off the walls themselves, that can't cause an anxiety disorder in the dog, right? What is the problem is when you have a dog that also has an anxiety disorder, living with a person with an anxiety disorder, and they're bouncing off each other. Like, I agree that that can be an issue. Yeah.
Yeah. And one, you have to wonder if the guardian, when they chose that dog, whether they were emotionally connected to the dog because maybe that dog was anxious and they're an anxious personality and they see themselves in the dog. Perhaps I've had a few clients that have either said, look, I suffer from, well, they say, they are quite open about it, I suffer from anxiety, I take prescribed medication for it, and then their dog is as well.
Yeah, I've seen that a lot too, and it's funny, I've even prescribed medications, the owner says, oh, that's what I'm on.
Yeah.
So the dog and the owner's been on the same thing, and it's like, one for you, one for me. I shouldn't laugh because, you know, it's not nice that we have to do this at all, but it is kind of, there's something comical about it. Yeah.
Anyone got any other questions before we let Dr. Dennis get on with his day? Doesn't look like it. So any final words?
No, I think I'd just say, yeah, thanks for listening and keeping an open mind, everyone. I think that, you know, there's a lot of, you know, there's a lot that is hard to wrap your head around, and, you know, with medications and, you know, when to give and when not to give. And it's basically, I think, just understand that there's professionals out there that do it really well, and that unless, you know, they're the ones that have done it and put the dog on the medications, that you can't really know what's possible and if they're good or bad for your dog or for a client's dog, for example, until you've had someone that just knows their stuff have a look at it.
Oh, yeah. Everyone's saying thank you, and Anna Marie says she's going to buy your book. Beautiful,
thank you.
Well, wonderful. Thank you everybody for joining us, and thank you, Dr. Dennis. And yeah, we'll let everyone get about their day, and we'll let poor Artemis and Stephanie go to bed.
Yeah, I'm very touched. Thanks, guys.
Yeah, it must be 3 a.m. in Greece now, just about 5 minutes to 3. And oh, hang on, we've got a question. Ron, could ongoing excessive licking, self-soothing be a sign of hidden pain? Our Springer Spaniel is currently on fluoxetine and occasionally trazodone for anxiety and hyperactivity. Wondering if gabapentin would be worth a try. He's excessively lick paws, genitals, sheets.
Yeah, sorry to hear that. That sounds really tough. Could be either. It definitely can be referred pain. Licking can certainly be referred pain. It can even be like blocked anal glands. Unlikely, but I've seen it. And yeah, it can just be anxiety coping behavior as well. So, and it can be skin disease, you know, yeast, that kind of stuff. So there's lots of causes to go through there. So yeah, it's on the list, absolutely. And yeah, I can't say what to do with an individual case because I'm not the vet in charge. It's a legal thing. But yeah, I'd say that these are all options and possibilities to look at, Ron.
Quite hard, isn't it? I mean, you've got to look at diet, allergies, pain.
Everything.
Yeah. Wow, Ron, I hope you get on top of it. Yeah.
Cool. All right. I better make a move. But yeah, thanks everyone.
All right, take care. See you.
Cheers. See you later.